500,000 appointments a year, a multi-million-pound business. With over 5,000 staff on 5 hospital sites, it's also one of the area's biggest employers. And all agree the University Hospitals of Morecambe Bay NHS Foundation Trust has recorded a turbulent 12 months.
Stay away from A&E unless it's an emergency.
The emergency department is for emergencies. If we're going to have a sustainable emergency department, we need emergencies to be seen here and only really emergencies.
If you're going to be a geriatrician, you've got a job for life, because that's where the big increase in workload is going to be. Because our biggest problem is exit block.
After a torrent of publicity, has the Trust, which came out of special measures earlier this year, turned the corner?
It's been really challenging this year, lots of pressures that our staff and patients are facing every day in accessing our services and making sure we're treating people in the right way. But we've done that alongside some really good pieces of work around our clinical strategy, Better Care Together, some of the local work we've done with Listening to Action and our teams taking forward clinical improvements, and some really good engagement with our populations and patients on developments like our new maternity unit, for example. So a year of real sort of building some stability and trying to take us forward after a challenging year in 14-15.
So what changes are underway, and what difference is it making to patients in Lancashire and Cumbria? Thousands of samples of blood pass through this state-of-the-art laboratory every day. It opened this summer, and it means that patients have the results sent back to them more quickly, and their treatment can be arranged even more speedily than before.
We do really, really well. I've got to say the professionalism of my colleagues is incredible. They're all really long-standing colleagues. They've been in the profession for many, many years, and they know their jobs inside out, which is why it all works so well.
And for Medical Director David Walker, getting patients through the system in good time or preventing them being admitted in the first place has been a particular challenge.
Hospital sometimes is not the best place for patients to be treated. You can get much better outcomes for most patients, particularly those who are old and frail, if they can be treated in the community or at home or in care homes, because hospitals can be relatively dangerous places for those people. So we're working very hard with our partners in social care and primary care to ensure that people are treated in the right place, and that will reduce the pressure on our A&E department.
Show us what's over here.
So what we've got is...
But it's maternity services that continue to cause interest for many. The Trust points to concrete plans as proof that it's more than just a culture that's changed.
Off the back of the Morecambe Bay investigation report was to create a new face for the hospital, but also make it functional for what's required. And what we did was we took quite an active role in the stakeholder engagement. So first of all, we liaised with the staff and set stakeholder engagements up with them initially, and then from there we took it into the community.
There's too much in the press, too much negative stuff. I think that the midwives and the people in the healthcare trust need somebody to come forward and say, no, actually you are doing a good job, and you know, it is appreciated.
This is new, isn't it?
Yeah, this is the birthing pool. Well, the staff are really excited about the new unit, and it'll be for the future generations. It's a modern, purpose-built unit. It'll have 14 labour beds where women will be admitted when they are in labour, and they'll stay there until they're discharged home.
For those who scrutinise what the Trust is doing on a daily basis, a sense that at Morecambe Bay the tide has indeed now turned.
I think what I've noted is a change in attitude in the staff, and perhaps an improvement in staff morale, really. If the staff aren't happy, then the service they give is not what it could be.
The organisation's governors have overseen the changes too. How do they view the past 12 months and the year to come?
I think there's a history within Cumbria of a lack of trust with a small t, which I think we are overcoming.
Do people have sufficient interest, do you think, in the Trust throughout the year, not just when there's a petition about pharmacy or A&E or whatever? Do you think people are that concerned or that keen to learn more about this place?
So there is a large number of the public out there now getting actively interested in what's going to happen to the delivery of their health service.
Out of special measures and with bold plans for the future, the Trust, its patients and staff will be watching closely what the coming 12 months will mean for the future of health in this part of Lancashire and Cumbria.